Language is something that is always around us. With it, we can communicate our thoughts and emotions, send emails, read books, and talk to our friends. However, it is often something we take for granted. We have all had that tip of the tongue feeling when trying to remember a word, but imagine experiencing this regularly. This is the case for 1.1 million Australians who suffer from a type of language disorder. There are many different types of language disorders, however some are more prevalent than others. Aphasia is a type of language disorder which impairs an individual's ability to write, speak, and communicate in a meaningful way. It is often a result of brain damage caused by a stroke, infection, inflammation, a head injury, or a tumor affecting the regions of the brain which control language and communication. In Australia, approximately 1 in 240 people suffer a form of aphasia, with 1/3 of stroke survivors experiencing it. The type and severity of this language disorder depends on the extent of the damage to the brain tissue and the exact location of the damage. There are different types of aphasia, and they can be categorized based on the effect on the patient as well as anatomically. Expressive aphasia, also known as Broca's aphasia, involves individuals having trouble expressing their thoughts through writing or speaking. The individual knows what they want to say, however they are unable to find the words to communicate effectively. This could be expressed through words being uttered slowly and not very well articulated. Receptive aphasia, also known as Wernicke's aphasia, involves difficulty understanding spoken or written language. The individual can hear voices and see writing, however cannot make sense of words. The brain is responsible for attaching meaning to speech sounds, so damage to Wernicke's area and the surrounding regions can impair the brain's ability to comprehend language. Global aphasia is another form of aphasia. It is a result of extensive damage to the language areas of the brain. Individuals who have this type of aphasia have lost almost all language function. They are unable to speak, understand, and cannot read or write. So how does this happen? The brain has two hemispheres. In most people, the left hemisphere of the brain governs language. Broca's area is a discrete part of the brain in the left frontal lobe of the cerebral hemisphere. It is responsible for language production, speech gestures, and coordinates the muscles involved in speech. Broca's aphasia is associated with large lesions which are not limited to the Broca's area, but extends to neighboring regions, such as the precentral gyrus, the anterior insula, white matter, and sometimes the basal ganglia and the anterior temporal lobe. Wernicke's area can be found in the cortex of the left cerebral hemisphere, surrounding a large groove called the Sylvanian fossa, near the junction between the parietal and temporal lobes. Wernicke's aphasia occurs when there is damage to the superior areas of the temporal lobe. Similarly to Broca's aphasia, it usually extends to the neighboring regions of the brain, including the temporal and parietal regions. Broca and Wernicke's area are connected by a bundle of nerve fibers called arcuate vesicularis. When this connection is damaged, people may also experience aphasia. Aphasia can be diagnosed using language tests conducted by a speech pathologist. These tests assess abilities such as grammar, ability to form letters and sounds, comprehension, and object knowledge. These tests may be supplemented by different imaging exams of the brain, including CT, MRI, and PET scans to identify the areas of the brain that are damaged. The current gold standard treatment for individuals suffering from a language disorder is speech-language pathology. Neuroplasticity is the brain's ability to alter its neural pathways and make new connections in order to repair itself. This involves the areas surrounding the damaged area of the brain taking over the functions of the damaged area during the recovery process. Speech-language therapy involves stimulating certain language and communication skills. Due to technological advances, several processes have shown promise in neurorehabilitation on patients suffering from aphasia. Non-invasive brain stimulation is a recent advancement. It includes procedures such as transcranial magnetic stimulation, TMS, and transcranial direct current stimulation. TMS uses magnetic fields to create electrical currents in discrete regions of the brain, Long-term use of TMS can have effects on the excitability and change the synaptic connections in the brain. Similarly to this, TDCS is the application of weak electrical currents on the brain, which again modulates excitability. Although research suggests good outcomes, these processes are not currently widely used in clinical practice. Aphasia is a prevalent disorder that affects many individuals, suggesting a need for further research to better understand language disorders and to provide meaningful treatment to patients suffering from a language disorder.